Hello everyone. Today I am going to explain the one of the strategy of the harm minimization. According to Killer ETAL, harm minimization is a progressive technique that tries to minimize such consequences from substance abusive behavior of drug addicts. The concept of harm minimization is not only reducing the harm associated with the drug use but also try to keep all safe or harmless as possible through harm minimization strategies. The National Drug Strategy 2016 to 2026 focuses on harm minimization through three different approaches, which are reducing the supply of drugs, reducing the demand of drugs, and reducing the harm from drugs. According to Hawk ETAL 2014, harm reduction is the central pillar of the harm minimization approach. The International Harm Reduction Association defines harm reduction as the policies, programs, and practices to reduce the adverse health and economic harms associated with the use of legal and illegal psychoactive drugs in an individual, families, and community who are unable or unwilling to stop. According to Splunding and Kennedy 2020, some examples of harm reduction strategies are labeling on cigarette packages, drug tests on employees, syringe exchange program, methadone maintenance program, and nicotine replacement therapy. The study by Brown et al. 2005 indicated that any reduction of harm from drugs is considered as the right direction where the amount of success is determined by the quality of life and well-being of people. Stopping smoking reduces the risk of tobacco-related diseases and extends life expectancy by up to a decade. An important part of public health policy on the control of smoking is the promotion of a reduction in intake of tar by persons who continue to smoke. The study in Champman, Wilson, and Wakefield shows that on a scale range of tar levels in all cigarette brands that are available in Australia, 69.1% smokers underestimated the level in their cigarette brands. On the scale, 56% smokers placed randomly chosen tar levels in the wrong category. It was agreed by 72% smokers that comparative tar levels should be displayed at all points of tobacco scale. It is recommended that a condition of issuing a license to retail tobacco should be that the tar, nicotine, and carbon monoxide level information for all cigarette brands that are available in a national market should be displayed prominently to the consumer by the retailer. Thus, labeling in tobacco does less harm to people. Taking illegal drugs before driving puts you at risk of injuring or killing self, friends, or other innocent people. Safe driving requires good judgment and sharp concentration. According to Transport of New South Wales, the NSW government takes a zero-tolerance approach to drug driving to stop drivers putting themselves and others at risk by getting behind the wheel after using drugs. Mobile drug testing (MDT) detects the presence of four common illegal drugs, that is, ecstasy, cannabis, cocaine, and methamphetamine. MDT can be conducted at roadside operations, along with random breath testing or by NSW police in vehicles patrolling roads. MDT has been increasing, and by the end of 2020, police will have doubled the number of roadside drug tests to 200,000 per year. This kind of testing decreases the number of accidents that reduces the harm among people. The most valuable resource a company has its employees. The research of CrossGov 2017 shows that corporate leaders or employers should test the drug among employees to identify and refer staff who have drug or alcohol problem. The drug test among employees improves the morale, productivity, and performance of employees, thus decreases the accident rates and turnover. The other way of reducing harm from illegal substance use is clean needle exchange and teaching the clients about proper injection to themselves. In the needle exchange program (NEP), an individual exchanges their used syringe with the new one, which helps to reduce the contracting disease like HIV/AIDS and hepatitis. The study among the prisoners done by Mogg and Levy 2009 in Australia shows the positive outcome of needle syringe exchange programs where there is a decrease in equipment sharing, reduction of infectious disease like hepatitis C virus. A study done by Splonding and Kennedy 2020 among 103 cities around the world, including data over 778, shows that implementation of NEP decreases the prevalence of severe and life-threatening illness. There is a decrease of HIV prevalence of 18.6% of people had undergone needle exchange program comparing to those cities who had never experienced it. Methadone maintenance program MMT is also available in many countries like Australia, Spain, Germany, and Canada. The study in a randomized controlled trial done by Dolan et al. 2006 of methadone program among inmates in New South Wales, Australia shows that treated prisoners had lower level of substance use and syringe sharing than non-treated prisoners. The study of 4 years follows-up demonstrates that inmates who remain MMT for a minimum of 8 months are less likely to transmit hepatitis C and die compared to non-treated inmates. Nicotine is the principal pharmacological agent that causes dependence on combustible tobacco cigarettes. The nicotine gum is a type of nicotine replacement therapy (NRT) that can be used to help stop smoking. Nicotine gum helps to reduce craving and feeling of withdrawal by replacing some of the nicotine normally get from smoking. Nicotine gum is often used together with the nicotine patches, which is a longer-acting type of NRT, to help quit. This therapy is more effective in cessation of smoking, which reduces the harm such as lung disease among people. In conclusion, there are many ways to minimize the harm, especially using the harm reduction strategies. Further to this, different programs and measures are implemented by government and non-government bodies to reduce the harm associated with drugs and substance abuse. Thank you.